Is casual mental health labeling undermining the support you get from your friends or undermining the support you give your friends? She ghosted me after I sent her that TikTok that proved she was on the spectrum. If that sentence sounds normal to you, like something you'd say or something you'd scroll past without a thought, please stop. Mental health is a big topic these days, but on social media it takes the form of listicles, memes, and sound bites. Feelings get lost in the shuffle. In this video, I'll discuss how to talk with friends about what's really important in mental health, and I'll give you some examples and suggestions. I'm Dr. Stephen Reidbord, a longtime psychiatrist and psychiatric educator. If you like what I'm doing here, please like this video and subscribe to More Than Meds. Apps that teach you to pathologize. The algorithms of social media on Instagram and TikTok and even here on YouTube are masters of engagement. They quickly learned that psychological terms like narcissist or gaslighting are compelling. They effectively capture users' attention. Suddenly, every ex-partner is a narcissist. Every roommate is on the spectrum. Every quiet colleague has selective mutism. This is more than just entertainment. It offers a series of simplified checklists. Match a few traits and you've reduced a complex human being into a tidy little diagnosis. This can feel like gaining insight, like you've finally established the why of how you or your friend operates. It creates a sense of control, but what's really happening here is a shortcut that bypasses true understanding. You're building a wall, not a bridge. It's a fast way of ensuring that your friends won't confide in you anymore, because who wants to be a specimen under a microscope? Social media thrives on this oversimplification. Complex psychological truths require time and nuance and critical thinking. In contrast, quick, digestible content, often from unlicensed influencers, they're not even really therapists, are what goes viral. The algorithms don't recognize or care that actual mental health diagnoses are complicated. They often involve extensive evaluations and ruling out of other conditions. Social media like TikTok is optimized for reposting 15-second listicles that explain 5 ways to spot a narcissist or to see if you have ADHD or antisocial personality. This echo chamber reinforces oversimplified notions of mental health. It feeds you content that aligns with your perceived prejudices, which can reinforce self-diagnosis and misperception of other people. It can mislead you. The appeal of playing therapist. There's profound satisfaction in labeling something. It creates a sense of certainty in a world which is very uncertain. Real relationships are incredibly messy. A diagnosis, in contrast, is very simple. When you can say, that's classic borderline behavior, the world sort of snaps into focus like the last piece of a puzzle. It can make us feel insightful, even powerful. Labeling also provides a kind of moral justification. If you decide your friend is a narcissist, then you're not being mean by not responding to their texts. You're just engaging in self-care. If your partner is avoidant, you don't have to think about the relationship between the two of you, the dynamics that are going on between the two of you. Instead, it's just an aspect of their attachment style. This thinking can relieve us of our own role in relationships. Social media is concerned with the instant reposting of catchy viral content, and it rewards this behavior with validating, never-ending encouragement and kind of self-reinforcing feedback loop. That's a dangerous trade-off where complexity is flattened and genuine understanding is sacrificed for virality. The unspoken cost. What happens after you've assigned a friend or yourself a diagnosis from social media? Whether you say it out loud or just think it internally, it's not a minor act. It actually has a lot of important implications. It carries a real cost. If you label yourself with a diagnosis based on a checklist, and then you turn to your friends for emotional support, you're really asking those friends to support your diagnosis that you came up with, not you as a whole person. You're far more than any label. But you're really asking these people, the people who most care about you, to put you into a diagnostic category, not the unique individual that you really are. You may imagine that they'll pity you more or take you more seriously, but actually, as I'll talk about in a few minutes, that's not true. And how about if you assign your friend an unofficial diagnosis? Well, first, as I was just saying, they cease to be a friend and become more like a case study. You're no longer truly listening. You're looking for evidence confirming the diagnosis you came up with. Every strong reaction is now their anxiety. Every canceled plan was their avoidance. Instead of asking them, how was your day, you ask them, how has your abandonment anxiety been today? This dynamic makes the other person feel evaluated, not genuinely seen. You're assessing their symptoms, not checking in with them as a friend. Second, the power dynamic becomes unbalanced. You take the role of a diagnoser, an expert, and they're the unwitting patient. Intimacy, that vulnerable exchange between equals, gets eroded when diagnostic labels start to enter the picture. The safe, non-judgmental space that's crucial for any relationship starts to evaporate. Your friend can't share freely anymore, knowing that what they say might be dissected and fit into a diagnostic checklist, labeled instead of just being heard and validated. They may begin to edit what they tell you out of a concern that you'll treat it like clinical data. Eventually, they may stop opening up at all. And then you might turn to other friends, other people, and say, oh, she's in denial, or he's not willing to do the work. The friendship falls away, leaving a hollow shell. All that's left are the diagnostic labels. That's not how real connection thrives. It's how it withers away and dies. Feelings are complicated. Our brains don't store emotion in tidy little packages. Feelings activate in complex networks. A given feeling, irritability, for instance, doesn't mean any one thing. It can manifest as part of depression or ADHD or PMS or a bad night's sleep or maybe just responding to a difficult day. I like to say it's like having a fever. A fever indicates that something's wrong, but it's not specific. It doesn't say what's wrong or why it's wrong. There are a lot of different causes of having a fever, and there are a lot of different causes of being irritable. When you apply a label to this complexity, you're jumping to a conclusion, what we might call premature closure. Unfortunately, that's now common thanks to social media content. A formal psychological or psychiatric diagnosis is a painstaking, nuanced prospect. It involves ruling out other conditions, considering the person's mental health history, and even their physical health history, how they view themselves or other people in their own minds, and the subtleties of their life circumstance. It's not about matching a few bullet points. It's about deep, comprehensive understanding, and that's why mental health professionals, like me, spend years studying our work, studying our field. Rushing to label misses the richness of human experience and actually misses some of the subjective distress that real life feels like, what it's like to be that person. And it's also important to remember that not every symptom means a diagnosis. A lot of times, a person's emotional stress or complaints are just a reflection of normal everyday life that falls within the wide range of what we consider normal. 3 suggestions. How can we pivot away from this diagnostic trap and replace it with genuine human connection to give and get real emotional support from our friends? Here are 3 suggestions. First, focus on feelings, not labels. Instead of saying, that sounds like bipolar, say, that sounds really exhausting. What's the hardest part for you right now? That is, switch from judgment and labeling to empathy. Instead of categorizing your friend's experience, validate their feeling and encourage them to say more about what's on their mind. You're opening a door for them to share their internal world. You're not putting an external label on it. Number 2, avoid ordering them around or prescribing. Instead of saying, you need therapy, you're broken, you need to be fixed, offer your own experience if it's helpful. I found therapy useful. I'm happy to share with you how I found a therapist If you're interested, let me know. Suggesting treatment can feel dismissive, like they're a case study instead of your friend, whereas offering your own experience can feel supportive. It normalizes the idea and reduces stigma. You're planting a seed, you're not giving them a command. Offering a resource, not a prescription, and you're there as a friend, not an authority. Number 3, avoid jargon. Speak in your own voice. Avoid terms like gaslighting, and instead say, "They confused me." In particular, gaslighting is a term that's widely overused and misused in social media. Instead of weaponizing it, focus instead on your own experience in the conversation. You're not accusing them of gaslighting, you're inviting clarity. This creates an opportunity for real understanding and dialogue, not a label that pushes them away. It keeps the focus on your shared connection, not on blame or a diagnosis. None of these require you to memorize the psychiatric diagnosis manual, the DSM, or even a short checklist. You just need to remain curious and stay human and focus on connection over categorization. When you do that, you're doing what we call active listening. This strengthens relationships and improves well-being, actually for you and the other person, because everyone feels heard and validated and less isolated. When concern is warranted, there's a big difference between being a supportive friend and being an amateur psychologist or psychiatrist. There are times when you actually should be concerned and you should act decisively. If your friend is so depressed that they haven't eaten for days and aren't functioning and start to talk to you about not wanting to live anymore, that's a time to act. Help them get to urgent care or to a hospital emergency room, or you or they can call or text 988, the suicide hotline. None of that is diagnosing them. What you're doing is you're helping to get them to a setting where they can be professionally evaluated, assessed, and helped. For everything else, the everyday struggles, the complex emotional conflicts, your job is not to name the storm. Your job is to offer emotional support and walk with them through it. It's about presence, not diagnosis, about being a companion, not a clinician. A few more constructive examples. Finding the right words may feel awkward at first, but it's worth the momentary discomfort. Try out these phrases or adapt them to make them your own. They're aimed for connection, not classification. I'm glad you told me. Are you looking for solutions, or would you like me to just sit here and listen? This empowers your friend to state their needs and also stops you from offering unwanted advice. It makes sense that you feel stuck. What's the one small next step that you feel you can do right now? This validates their current feeling while gently suggesting agency, that there may be something they can do about it themselves. I don't know how this will resolve, but I'm here for you and for anything you wish to share. This unconditional support acknowledges life's uncertainty. You don't have all the answers, and it doesn't promise a quick fix. I notice you've seemed down lately, and I wanted to check in. How have you been lately, really? This gently opens the door for conversations, inquires without being too directive. And that sounds really difficult. It's a simple, powerful message that you're listening and empathizing. Friendship is not built on being a know-it-all. It's built on a genuine effort to connect and a willingness to show up for each other, even without all the answers. Personal benefits of resisting labels. Listening without labeling isn't just helpful for your friends, it's very helpful for you too. It trains your mind to tolerate ambiguity and to sit with discomfort without an immediate need to resolve it or categorize it. Each time you resist the urge to diagnose and instead choose curiosity, you're building your capacity for emotional regulation. Over time, this practice builds genuine emotional strength and resilience. You become the friend who remains calm in a crisis, the partner who doesn't retreat when feeling vulnerable. You're capable of giving emotional support that reduces the feelings of isolation and improves the well-being of others around you. This kind of deep social connection is a critical factor in mental health and even physical health. Emotional strength is not built on pop psychology. It's built one uncertain conversation at a time. The freedom of not knowing. You're allowed to finish a conversation and feel, there's something off with my friend, without categorizing it, without needing to name it or attaching a diagnostic label. You're allowed to research symptoms, and I'm sure you will, and still choose to say nothing. Curiosity without jumping to a verdict is a really powerful skill to have. You can observe, wonder, educate yourself without becoming the judge of your friend's mental state or labeling your own with an impressive but possibly incorrect diagnosis. You can hold space for experience without needing to define it. This permission you give yourself to not know, to not have all the answers, is very liberating for yourself and the people around you. It fosters a humility that makes space for true connection and true understanding between people. Some final thoughts. Social media presents the public with a new vocabulary for mental health. What's not provided are the years of supervised clinical supervision, the ethical standards, or the nuanced understanding that's required to use that vocabulary responsibly. In a professional setting, these labels and diagnoses guide effective treatment, help people get what they need. But in a group chat or in your own mind, they corrode relationships and tarnish your view of yourself. So the next time an algorithm serves you a checklist that seems to perfectly describe yourself or a close friend, hit pause. Instead of diagnosing, simply ask your friend how they're doing today. How are they feeling? What's on their mind? What are they excited about? This will ensure you remain invited into their messy, complicated, beautiful reality. After all, that's where real connection is. Somewhere short of certainty and more than just silence or avoidance, and light years away from a simple checklist or viral clip. If this video has been helpful, please like this video and put your thoughts and comments down below. And stick around, you might be interested in this video as well. Thanks, and I'll see you next time.